If you are a woman over 40, you are likely navigating a new chapter of biological shifts. It is common to attribute changes in energy, sleep, or skin to the natural progression of perimenopause or a busy lifestyle. However, some shifts are not just signs of aging, they are subtle metabolic whispers. While your body naturally changes its hormonal composition, it also becomes more sensitive to how it processes glucose. Understanding the distinction between getting older and metabolic slowing is vital for your long-term vitality. This is not about alarmism, it is about precision. Today, we are examining 5 specific signals your body may be sending that indicate your blood sugar requires closer attention. Before we break down these 5 signals, take a second to subscribe and toggle the notification bell. Protecting your metabolic health starts with staying informed. Now, let's look at exactly what we're covering today. In the next few minutes, we will identify the 5 silent indicators of insulin resistance and early-stage diabetes. Specifically tailored to the female physiology after 40, we are moving past generic symptoms like extreme thirst to focus on the nuanced signs that often go overlooked in annual checkups. You will gain a clear framework to differentiate between hormonal fluctuations and genuine metabolic distress. By the end of this guide, you will have a practical checklist to discuss with your healthcare provider and a clear path toward reclaiming your metabolic health. No vague advice, just 5 specific markers and the biological reasons they matter to you right now. After age 40, a woman's metabolic landscape undergoes a significant recalibration. As estrogen levels begin to fluctuate and eventually decline, your cell's sensitivity to insulin often decreases. This is a documented biological pivot. Estrogen plays a supportive role in glucose uptake. When it retreats, your body must work harder to maintain stable blood sugar levels. This creates a metabolic lag where the energy from your food struggles to enter its cells, remaining in the bloodstream instead. Understanding this hormonal metabolic intersection is the key to prevention. It is not a failure of willpower. It is a shift in internal chemistry that requires a strategic response. Delayed skin healing, minor scratches, or bruises taking longer to fade. High glucose levels can impair circulation and restrict the delivery of nutrients to your skin. If left unaddressed, this can lead to chronic inflammation and permanent tissue damage. Adjustment: track the healing time of small nicks and prioritize high-quality protein intake. Sudden vision fluctuations, occasional blurriness that seems to come and go. Rapidly changing blood sugar levels can cause the lens of your eye to swell, temporarily altering your focus. Ignoring this can lead to permanent retinal strain. Adjustment: schedule an A1C test if your prescription seems to drift. Recurrent skin tags or darkening, small growths or patches of velvety skin around the neck or underarms. These are physical manifestations of high circulating insulin levels acting as a growth factor. If ignored, it typically signals progressing insulin resistance. Adjustment: monitor skin texture changes as a primary metabolic scoreboard. Disrupted sleep cycles: the 3 a.m. wake up, waking up suddenly in the middle of the night feeling alert. When blood sugar drops or spikes unevenly, the body releases cortisol to compensate, snapping you out of deep sleep. This leads to chronic fatigue and further insulin resistance. Adjustment: stabilize your evening meal with healthy fats and fiber to prevent glucose crash during the night. Atypical fatigue after meals: a heavy, foggy feeling immediately after eating. This occurs when your body is struggling to move glucose into your cells, leaving your brain starved for energy despite just eating. Over time, this exhaustion becomes your new normal. Adjustment: implement a 10-minute walk after your largest meal to assist glucose disposal. Metabolic health is cumulative. The choices you make and the signs you acknowledge in your 40s will dictate your quality of life in your 60s and 70s. Ignoring these subtle markers isn't just a matter of dealing with it later. It is allowing internal wear and tear to accelerate. Your health is your most significant asset, and your body is providing the data. You need to protect it. Taking responsibility now means avoiding the complications that many accept as inevitable. You have the autonomy to change your trajectory. The goal is not just to live longer, but to remain functional, sharp, and independent for decades to come. To recap, we've identified delayed healing, vision shifts, skin changes, sleep disruptions, and post-meal fatigue as the critical signs to watch. Moving from a mindset of ignoring to one of investigating is the most important step you can take today. These symptoms are not your destiny, they are data points. Take this information, review your recent physical changes, and prepare to have an informed, data-driven conversation with your doctor. Your 40s are a period of transition, but they should not be a period of decline. Knowledge is the first step toward metabolic mastery. While identifying these 5 signs is crucial, understanding how to reverse them through targeted nutrition is the next logical step. In your journey, in our next session, we will break down the glucose-first grocery list, the specific foods that help stabilize insulin levels. Without restrictive dieting, we will look at how to pair foods to prevent the spikes that cause the symptoms we discussed today. You won't want to miss how a few simple swaps can transform your energy levels in as little as 14 days.